There we go. Well, hello, everyone. My name is Amy Berman, and I come to you from the John A. Hartford Foundation in New York City. It is a great honor to be here, and I am delighted to see all of you here in support of this incredible work. And I thank the team at Respecting Choices for their national and international impact. This is such important work. This room represents collaboration. So I want to start off by talking about why we do what we do. These are my parents, Mike and Rhoda. Mike is 83, Rhoda is 80. I took this picture on a 4th of July, and they have this magical way when you say, I'd like to take a picture, they fit together perfectly every time. He's 6 feet, she's just over 5 feet. They fit perfectly every time. 61 years of marriage, that's how they fit together. So I caught them in the midst of this fireworks in Coney Island, New York. And, you know, this kind of represents the sparkle. But the reason why I show them is because the reason that we're here really is about preparing people for times that are not like this, and making sure that people know what they want, share what they want, document what they want, so that hopefully we can provide care that supports their decisions. It's all about making sure that people at whatever age are able to, as much as possible, participate in the experience of their care and make the care the right care. So my parents kind of inspired me, and my mother's mother had Alzheimer's and came to live with us, and all of these things formed my own desire to go into this field around care of older adults. And so I'm going to tell you very briefly about where I come from, just as a framing for why we do what we do. So I come to you from the John A. Hartford Foundation. How many of you have heard of the John A. Hartford Foundation? I'm actually surprised. Okay, so it's almost half of you in the room. This is very surprising because I don't know who would have heard of us. But the John A. Hartford Foundation is located in New York City, and we're a national foundation. And our entire mission, from soup to nuts, is that we are dedicated to improving the care of older adults. I have an amazing colleague here with me, Jane Carmody, if you wouldn't mind raising your hand, so I hope everybody says hello to Jane. A former chief nurse officer, absolutely brilliant and as dedicated as anyone ever will be in these issues, like me. The foundation has been around for a long time, and there are certain areas that we focus on, and so I'm just briefly going to share with you the 3 areas. One is called age-friendly health systems, so across the continuum of care, from primary care to hospital to community-based organizations and all of the social supports and services, and to the kitchen table and everywhere in between, wherever you're receiving your care, certain things need to be safe, they need to be done, and they need to make sure that they are doing what matters and taking care of people in a way that's going to support the best possible health outcomes. So that's the notion of an age-friendly health system. We also do work around support for family caregivers, and we also do work in the domain that we're really talking about today, which is serious illness and end of life. And these are all mutually reinforcing. There's a lot of false lines between them because it's the same people in these different spaces. But this is how we think about our work. We've provided more than $500 million to date, with a B, billion, in terms of advancing models of care, a lot of things that we do. Bud very kindly, talked about our support for different things in the field, and I'll tell you a little bit more about some of them. But we are one foundation. We are a significant foundation in this area of serious illness and end-of-life care, of care of older adults in general. And our work would not happen were it not for partnerships, were it not for collaboration. So a little bit more on age-friendly health systems. It is about focusing on what matters, improving health outcomes, reducing harms, and achieving lower costs and better value. Family caregiving, helping health systems themselves assess and address the needs of families, and also advancing policy for family-centered care, which is so important. And then in serious illness end of life, it's about palliative care, advanced care planning, and promoting competence and expertise in the workforce to be able to do this work, which is really what you are all about. So thank you, thank you, thank you. Bud told you that we've supported the Center to Advance Palliative Care. By way of background, we've supported them for about a dozen years. I've had the pleasure of working with Diane Meyer and the team at the Center to Advance Palliative Care for about a dozen years. And in that time, I'm sure you know, the field has grown. It was not what it was. But there is a community of about 25 funders that support this work, and a lot of other local efforts to help build this work. So building a field, now we're in about 90% of medium to large hospitals, palliative care, and we're now beginning to expand in community-based palliative care. None of that happens without all hands on deck. One of the ways that we did grant making to build collaboration and to engage funders was to put together different initiatives and provide each one with some support, including respecting choices. You see respecting choices big, prominent. So all of these things together to be able to also work together in support of advancing a vision for serious illness care in this country. And so there's been communications work that is ongoing and will continue. But all of these efforts, I'm not sure if you know all of these efforts, the Serious Illness Project, Vital Talk, National Pulse. Amy Vandenbroek is in the room, I believe. Amy, are you here? The Amy Vandenbroek, who heads National Pulse, CTAC, the Conversation Project, and of course CAPC. And then in doing this work together, some amazing things have happened, and I'm going to tell you a little bit of a story about it. But before I do, I also want to tell you that we do work in other domains in support of serious illness care. How many of you are familiar with home-based primary care? Okay. For people who might not otherwise be able to go to seek their primary care, it brings a team of people into the home. So there's a demonstration called Independence at Home, but the idea is to be able to provide these services to people who otherwise are getting very poor care. They're only showing up in the emergency room. And so in doing this work, we're working with a lot of organizations around measuring quality, doing national training, and also in support of understanding what the cost should be for these services so that we can get a payment model out. And we do this work with a number of other funders, including West Health and also the Commonwealth Fund. So this is the story of collaboration. This is where we were when I came to the foundation and started doing work in the field. And I'm a nurse, and I come with a background around care of older adults, and I have had a long-term commitment to these issues my whole professional life. Bless you. So when I came, there were only 5 significant funders interested in serious illness, end-of-life issues. 5. That is terrible. And over time, 3 of them left. One of them decided that this was no longer important to them. They felt that, we had won the battle, we're done. Well, okay. I happen to agree, but I didn't laugh. One was a spend-down foundation. So there are foundations that want to spend the money in their lifetime so that no one is taking advantage of the money later, so that they have control over how those monies are spent. And they did a magnificent job while they were there, but unfortunately, they spent down and closed their doors. And then the last one as many foundations do, they do work in the area for a period of time. And even though they knew that there were still tremendous needs, they left because ultimately their trustees said, well, we have other work that we really need to be able to do. And so for a whole host of reasons, when you have 5 funders, eventually you'll have 0 funders. So the notion of having many foundations engaged in this work really became important to me. I came in and we had discussions in the foundation. This actually was not an area that we did large amounts of funding in. It is now, as you notice, one of our 3 priority areas. In other words, major funding from us, consistent and long-term funding happens, So we've changed our strategy, and this is now an element that is major for us. But what's happened over time is we now have a funding forest. Now that funding forest can become more lush. This is the most lush picture I could find, but it can get lusher. Is that a word? Lusher. I just like saying that. We now have between 40 and 50 foundations that are doing really significant work in this area. And part of the genesis of this, a number of years ago, I think now it's probably almost 10 years ago, we were trying to figure out how do we engage other funders to join us since we saw these foundations leaving. So it started by offering a challenge grant. We would fund the Center to Advance Palliative Care if other funders would match some of the funding. We would have given the money anyway. I mean, that's the bottom line for all of you in the room. But it was a way to spur interest, and it actually kept one of the foundations that wanted to leave. It kept them in. But it wasn't sufficient. That was a Band-Aid on a bigger problem. So next, I decided to convene a whole group of funders that were interested in aging issues. Now, I realize we're across the age spectrum, correct? We have pediatrics, we have geriatrics, and we have everything in between. But I decided I would focus, since the majority of these issues really focus on older adults, and since this was my foundation's mission, I could, at least knowing these people, engage them. And I brought them to the foundation, and we had a meeting that went over different people's interests and things that they were looking at, the interests of their board, their strategy. And as they were discussing what they were thinking about doing, they were identifying that they were not doing work in this domain. I had also brought in the 2 organizations over these foundations. One is called Grantmakers in Aging. It's a group that convenes all of the funders interested in aging, and Grantmakers in Health, which convenes all foundations that are interested in anything related to health. So they were in the room. And at the end of the meeting, the one thing that came out of it was that they would be willing to try having calls, monthly, bi-monthly. We started with monthly phone calls, to go over what were the things that they could be doing in this space, to just create a safe space for people to learn, to share, to talk. They didn't yet have to know that they were going to fund in this space, but just a safe place for us to talk. We invited some experts onto the calls. Some of the foundations had expertise, and we talked about issues. Over time, that group has grown. We have grown so much that I think we have about, I would say, between 50 and 60 participants every other month. But I'll share with you one story that came out of it, because this is really interesting about how collaboration starts. And by the way, we don't own this group. Nobody owns a group. Going to the notion of the web, the only way that this could work is if everybody feels ownership of the issues and the group. So we take turns leading. Anybody says they want to lead, everybody sends in agenda items, but nobody owns this. It is the group owns it. So one of the groups that Bud mentioned, PCORI, the Patient-Centered Outcomes Research Institute, they had long said that they were interested in this area. And they had long said that they could not fund in this area. This was, there was talk in the Beltway. I'm sure you remember the difficult conversations about topics around advanced care planning. Does anybody remember that terrible term that was used? I'm not even going to say it. But it was a difficult topic to discuss in the Beltway. And PCORI is in the Beltway. That was a challenge. Well, it came time to do an evaluation of the Center to Advance Palliative Care. And our foundation picks a consultant evaluator to come in and review the grant with us. They write a report, we write a report, and that information goes to the board. So I thought, well, maybe I will ask somebody of prominence in PCORI to serve as the consultant evaluator. Maybe then they'll get it. They agreed. They agreed to come. And the person, I won't name him, but he came and he did a review of the Center to Advance Palliative Care. And he said, I never realized the depth of the work and the needs. I never realized. A year later, PCORI had funded $79 million to support grants around community-based palliative care and, yes, advanced care planning, including the funding that came here to Respecting Choices. I wasn't the only one who had a hand in it. I can tell you many people did. But there was a major aha moment because all of a sudden they could see there was a reason to collaborate. And by the way, their board, the board at PCORI, told them that they could fund up to $48 million. But I will say that the field, all of you, all of the foundations, everybody engaged in this work, put out information to all of our stakeholders to be able to prepare proposals and really rise to the challenge. And they got such great proposals that even though they had only allotted $48 million, they approved $79 million. It's an amazing story of collaboration. And in this way, they are working with foundations around the country to also support these efforts. And they're working with institutions around the country, the leading innovators, like Respecting Choices. This team is amazingly innovative. And so we're building a funding forest, not fast enough, but we really are building a funding forest. So we launched the Serious Illness End of Life Funders. It's not a very original name, but that's the name of our group that we have our regular phone calls. We also now have meetings, convenings. And some of the foundations, this is a very short list, but the Gordon and Betty Moore Foundation, which you heard about already, which also supports Respecting Choices. West Health and the Gary and Mary West Foundation, they've been tremendously engaged in this work. Retirement Research Foundation in Chicago. The Archstone Foundation, California Healthcare Foundation, Stupsky Foundation, and I could go on a list for the rest of my talking time, which I will not do. But there are many, and none of these existed, not one existed as much as maybe 6 or 7 years ago. They are all in this now, except Archstone. Well, Archstone and California Healthcare Foundation, those are the only two that have been in it for the long term. So they are wonderful, and they are two that have been in it for a long time. So in terms of collaboration, there have also been evolving roles for funders. So yes, we fund. You may think of us as a giant ATM. You put in your card, punch in the numbers, put in your PIN, and hope the money comes out. But the foundations, there are different foundations that work in different ways, but a lot of the foundations today are actually engaged in the work. You know, everything from doing analysis to going to the Hill, to writing and speaking and trying to make change in support of what you do, talking about what you do, giving examples of places that are implementing this work, highlighting your work, where wind at your back. So this is testifying to the Senate Special Committee on Aging, along with Atul Gawande and Kate Lally, who's a palliative care physician, as they were considering creating a payment model, some legislation around that. So Bud mentioned that I have my own story. So I was diagnosed with stage 4 cancer. And so another way that I have used this, remember I've been a supporter of this since long before ever being diagnosed. But I was diagnosed 8 years ago with something that my life expectancy, they said 11 to 20% survive 5 years. Can you imagine that, 11 to 20%? So it's 8 years, and actually this month it's 8 years. Yay! So the story behind this is, does anybody remember that they came up with advanced care planning codes, you know, to pay for advanced care planning? I hope you all are following that there, you know, it may not be a lot, but this is such a fundamental shift for the Centers for Medicare and Medicaid Services to say, we should be paying for this. This is a great starting point. Well, this was up for public comment, meaning that the possibility of paying for advanced care planning, there was a place on CMS's website for people to write in whether they agreed, disagreed, and a lot of societies and individuals wrote in comments. And so I waited until the comment period closed, and a week later they were going to be making the decision about whether to put this into the physician fee payment schedule. And I asked the editor of the Washington Post's Health and Science section if she would allow me to write an open letter to CMS in the health section. And the tagline was, "Planning for the end has saved me." Because of course, you know, planning for the end saves us all. And so I talked about advanced care planning, and it became in the Beltway. This is a selfie picture taken, you can't see the whole thing, but I'm there in the exam room in one of those white robes that people wear. And I took a selfie picture because what was I going to send to the Washington Post? And they published the letter. It got a huge response. And that response was the last thing that CMS saw before making their decision. So a person within CMS, who I had been writing with, invited me to CMS to meet with him. And I told him I wanted to take a picture with him because he had been really an advocate internally. And I said, I want to take a picture of us together so that you remember why you're doing what you're doing, and I remember why I do what I do. And so we took our picture together on that day, and what I didn't realize was that he invited me the day that they were announcing that they were going to pay for advanced care planning. And that was incredibly special, and many, many people were engaged in this work, but you wouldn't think of that a foundation collaborates with CMS, but we do. So the other thing that I do in support of everybody in this room is that I show that it's helpful to live a good life, even with serious illness. This was not taken a long time ago. This was taken about a month ago. This is snowmobiling on a glacier in Iceland. Yes. And as my partner in crime, Jane, knows, I will be going to the Arctic Circle to go reindeer sledding in December. And every time I do, if you follow me on Twitter, which is Notes on Nursing, or you can also look at John A. Hartford Foundation, I tweet to policymakers and to people who are influential about the power of what we do. And I give them the reason why it's important to do what we do. So in closing, this is me with my parents. I did want to say that, it takes a village in terms of funders. It takes collaboration in many, many ways. And you don't know what you can leverage out of the people that you work with. Take full advantage. I do want to say that my father, Mike, passed away last Saturday. But the reason that I'm sharing this with you is because my father had an advance directive, and I was his proxy, and we knew what he wanted. My mother knew, all of the kids knew, we all had conversations. He died peacefully on hospice, well cared for with his family around him, and everything that you could want. He got everything that we aspire to. And that's really the blessing of doing this work. So collaborate on. Thank you.